Hi, welcome to BonnieWork. My name is Bonnie. In this video, we're going to do anti-inflammation self-treatment, acupressure of 3 different points for upper body pain release, anti-inflammation, and joint arthritis help for the arms, the fingers, the neck, and headache relief as well. So the first point we're going to do is contraindicated for pregnant women. So if you are pregnant, unless you're very close and you want to go into labor, don't do this point. It may help your labor if you are there. Otherwise, it's okay to do this point. So this point is called joining the valley. It is right in the webbing between your thumb and your first finger. When you bring them together, you'll have a mound there. If you put your finger there on that mound, then when you relax, it becomes a valley, and that's the valley that you want to press on. So you can use any finger you want or use your thumb, and it's pretty easy to just soften, relax your arms and your shoulders, and just push on that place right there in your hand. We're going to hold that for 30 seconds to a minute. You can hold it up to 2 minutes. After 2 minutes, it ceases to be so helpful, so it's better to go on to the other points and then come back to this point if it feels particularly helpful for you. If this point is very sensitive for you, then it's a very good point for you to work on. If the point is very painful, then go a little lighter. It doesn't need to be painful to be effective with acupressure. In fact, if you're causing pain, you're probably increasing your inflammation there, and you don't really want to do that. This is to decrease inflammation. So let's hold on to that point just a little bit longer and breathe and relax and be comfortable. Good. And then let's release that point. Let's do the other hand. So again, if you push your thumb and first finger together, you get a little hill or a little mound right there. Put your finger on that. When you relax your thumb away, then you have a little valley or indentation. So we'll hold that with your thumb or your fingers and relax your arms while you're pressing into that point. Make sure you're in a comfortable position. If you feel anything happening, pay attention to that. This is really good point for headaches. It's a good point for pain anywhere in the body or inflammation, but especially the arms, the shoulders, and the neck and the head. So we're going to hold out a little bit more. I like to move around, but you could be completely still. It's all effective. When I move around, I'm noticing the different areas in that point. So you can come from a different direction and get a slightly different feeling on that point. Trigger points are that way as well. It's possible to have a trigger point in where your acupressure points are. Okay, so let's release that place. You can move your hands, shake them out a little bit, do a little bit of release. And then the next point we're going to do is it's near the wrist. If you bend your wrist and you do 2.5 fingers down from the wrist into your arm, you want to be right between the 2 bones of the arm there. And then push down on that spot that's about 2.5 fingers away from the wrist crease on the outside. So same thing here. You want to make sure that you're relaxed. I'll back away a little more so you can see it. Soften into that place. And again, make sure that you're comfortable, you're breathing easily. Notice now with this one, I tend to have a tight neck with inflammation. So I notice this one relaxing the base of my skull, very top of my neck. I can feel it softening. And the longer I hold it, I start to feel a little more in the shoulder too. See what you notice. It's different every time, and it's different for every person, depending on how you are in the moment. All right, so let's release that point. Rub it out, move around a little bit, releasing. can move your neck and shoulders since it's affecting them too. And then same thing on this side. So you want to bend your wrist. Notice where the crease across the wrist is there. Do 2.5 fingers from that crease of the wrist, and then right between those two bones on the outer forearm. When you move the wrist up and down, you'll feel the muscles working. So you want it to be relaxed and not tightened, because you don't want to be pushing against muscles. Acupressure is about the Meridian System. It's the Oriental Medicine system. It's not about musculoskeletal work. We're not working the muscle. We're working a point along the meridian. It's an energy point that is affecting the whole body in order to reduce inflammation. This particular meridian we're working on right now is triple warmer, or sometimes they call it triple heater, and that works with the endocrine system. So endocrine system is very helpful with anti-inflammation. It sends out anti-inflammatory hormones like cortisol that works through our body to reduce the inflammation. All right, so I think we've worked that one enough. Let's also rub that out, release that work that we just did there. Okay, and now the third point we're going to do is again on the large intestine meridian. So if you bend your elbow, we're on the outer part of the elbow, there's a little bone right there that you can feel. Go into the crease. If you keep following the bone around into the crease there. And this is another valley here that we're working. So you want to just hold that. You could hold it with any finger or group of fingers. You can hold your hand on your other shoulder if you like to get that point there. Or you could lower the arm even more. I'll stand up so you can see it. You can just do it with your thumb as you're kind of standing with your arms folded. Yeah. So we're going to just continue to hold that point and continue holding that point a little longer. And again, you can move it around if you want, or you can stay still. Most importantly is that you are relaxing into the position, softening and breathing, and noticing what this is doing for you. Noticing any anti-inflammation effects here. If it's pain or if it's increased mobility. Often it happens while you're treating yourself, but more often you'll have lasting after effects where you may not feel it as much as when you're working on yourself, but you'll feel it after as your body is integrating the change that you're creating. So let's end that one there. Let's go to the other arm. So same thing, you bend your elbow, you find the little bone out that's sticking out on the outer arm, outer elbow. Follow it around into the crease. Sink your fingers gently into that crease, and then just relax your other arm so that it's not working. Your other hand is the thing that's working. And sink your fingers into that spot. Not too hard, not too deep. If this place is sensitive, then you know that it's something that you need to work on. So it's a good point for you. When that point ceases to be so sensitive, then you're actually getting better in that place, getting better along that line, and probably reducing your inflammation. Let's hold that and breathe and relax a little bit longer. Good. All right, let's release that place. Again, move your arms around, move your shoulders and your neck very gently, not too hard. And then notice how you feel after that. Do you feel anything smoother or easier? Maybe if you have arthritis, are your fingers moving a little bit easy? Notice even not just now, but in the next few hours, if there's an after effect of this self-acupressure treatment. Acupressure is very gentle, but it's very effective, especially if you make a practice of it every day. Finding an area that is really important for you to heal and then continuing to work those same points daily. Make it part of a practice. Thank you for joining me for BonnieWork. I hope you have been helped by this video. Pass it on to anybody else that you think it may help, and subscribe if you would like more videos from BonnieWork. I wish you well.